Nasarawa State has confirmed 6 cases of monkeypox in 2 local government areas. The State Commissioner of Health, Ahmed Baba Yahaya, said the first case was reported in Kefi local government in May this year. Well, according to him, healthcare workers in the state have been sensitized and trained on the occurrence of the disease, while drugs and essential commodities have been procured and treatment obtained in all general hospitals as well as the Federal Medical Centre, Kefi. And health authorities in Ghana have quarantined 34 people following 2 suspected cases of the Marburg virus, a highly infectious disease from the same family as Ebola. Those under surveillance were part of contacts traced to the suspected cases. The health authorities say they are closely monitoring the suspected Marburg outbreak reported in 2 different locations in the Ashanti region of southern Ghana. Well, the World Health Organization and the Ghanaian authorities are conducting further checks and have begun preparations to contain the possible outbreak. To help us make sense of these developments, with us live in the studio is the Head of Communications, Nigerian Centre for Disease Control, NCDC, Dr. Yahaya Disu. Thank you so much for joining us on the news tonight.
Thank you for having me.
So your agency has issued an advisory warning Nigerians about the likelihood of a spike in coronavirus cases. Can you tell us what is informing this advisory?
Well, the reasons are not far-fetched. And if you actually look at the global trend now, there are rising cases and then there is movement in and out of Nigeria. So we also started reporting increase in cases from week 21 to week 24. And then data is already suggesting that. Then if you also look at the last 2 years, we also had peak around this month, and which coincide with the rainy season. So this could be seasonal infection, because usually you have respiratory illnesses around this time of the year. So that could, also, of course, COVID-19 is also a respiratory illness, it's not exempted. So it could be one of the reasons for cases. And then you also see increase in testing because we continue to drive testing across the states, and because of that, so that will also be responsible for picking these cases. And then, of course, the sublinear, sublineage of this Omicron that is responsible for driving the cases, rising cases across the globe. We also have it in Nigeria. So those could be the reasons. And more importantly is the issue of low vaccination coverage, which further reduce our vulnerability to the disease. And then it's also coupled with the fact that if you consider the natural immunity that is waning, because of over time, the immunity is supposed to wane. And if you are taking the vaccine, and then maybe we will have been protected against it. When I say natural immunity, because for those who have already been exposed to the natural infection, we have some protection. We know they don't confer life immunity. So that's why we urge Nigerians to take the vaccines. Okay,
and you know, we have a problem with vaccine intake here in the country, like you've mentioned. But what, in your opinion and in the agency's findings, is responsible for the low intake of these vaccines?
Well, generally, vaccine hesitancy is something that is a major reason why we are having this. And then there are factors that could be responsible for this.
Such as?
Confidence-related issues, confidence in the vaccine, efficacy, safety, and then I think now people who are afraid of the vaccine, nobody has reported severe adverse events following the vaccine. And then you have millions of people who have taken it in Nigeria. There are issues of misinformation, and then the issue of low-risk perception, because restrictions have been lifted on the restriction protocols for the COVID-19. So people take that to be that this is the end of COVID-19. No, as long as we have these cases across the globe and we are still vulnerable, a threat anywhere is a threat everywhere. And people are not even complying with the use of pharmaceutical intervention, non-pharmaceutical intervention in crowded places and in closed settings. and then because of the low risk perception. So those are the drivers. But I think our sister agency has been trying to increase access to to ensure that the referral facilities, health centers, these vaccines are available. So the vaccines are available, but the uptake is the issue. But we need to continue to educate the population and then to convince people the benefits of this vaccine, why they need to take the vaccine.
Okay, let's go back to the numbers. And you did say that we saw a spike this same period last year. That's why you think it's seasonal?
Maybe because this coincides with the peak of the rainy season. And then you usually see respiratory tract infections around this time.
So, is Nigeria still in the 4th wave, or are we seeing the beginning of a 5th wave of the coronavirus pandemic?
I don't know, we are out of 4th wave.
Okay,
so because that was why what informed the relaxation of the protocol.
So, is this we are in the 5th wave?
It could be because, like what we are seeing in Lagos now, it usually heralds the waves. So it may be, and we need to pay more attention. We are working with the states, especially Lagos State, to make sure that surveillance is increased, and then pick these cases through testing, encourage people who have symptoms to go to facilities where their samples can be collected, and this testing can be done so that they can confirm that if it is COVID or not. Can
we truly say we are able to track this pandemic in Nigeria at the moment? You talked about increased testing, but when you look at the statistics and data provided, a lot of the laboratories, both public and private, are either not testing or are not reporting their data. So how are we monitoring when we are not testing enough? What is the level of cooperation and collaboration between the federal and the subnationals at the moment?
Subnational authorities have been responsible for the testing. What we do is to provide the guidelines, support, capacity, and support with the reagents. And now what we're looking at is the use of RDT, rapid diagnostic test kits, which make testing more readily available. And then there is also the national drive for testing. And so that rapid diagnostic test kits, those barriers that people usually complain of, that they don't get test results immediately. And now when you do rapid diagnostic test kits, and when you use it, in the next 20 minutes or so, you can get your results. And so it makes it very easy for even the healthcare workers who suspect this. So we're working with the state to build capacity and to make sure that they identify locations where these testing kits can be made available.
But what's the level of testing is what I'm trying to find out here. And you talk about the, sorry to interrupt you, but that's on one side. On the other side is you talk about these rapid test kits. Are they readily available to Nigerians? And is it for free? Where can they get them? Or they still have to pay for them at the subnational levels?
No, they don't pay for it.
Okay.
What we're trying to do is to work with the state now and drive the campaign. There are teams who are on the field working with the states. It's in phases. Especially we prioritize the states based on statistics and then the risk. And then, of course, if the facilities are available, you also need people to be convinced, to be willing to come and take the test. So social mobilization, risk communication are all combined with the efforts to increase testing. But we are noticing increase gradually in the last couple of weeks. So we are hopeful that this will continue. And then we encourage everybody, even the media, to raise awareness about this, and so that people will know when to test and where to test.
Dr. Yahaya Disu, the head of communications at the NCDC, that's the Nigerian Centre for Disease Control and Prevention in Nigeria. Thank you so much for coming on the news tonight. We do appreciate your time.